141. What does the term effacement refer to? A. The direction the fetus is facing during the birth. B. The position of the fetus in the uterus prior to birth. C. Thinning of the cervix during the first stage of labor. D. Opening of the cervix during the last stage of labor. Answer C. Rationale. Effacement refers to the stretching and thinning of the cervix, which occurs during the first stage of normal labor. 142. Your patient is a 33-year-old woman who is 9 months pregnant. She complains of severe abdominal pain and abdominal tenderness. She reports there is no vaginal bleeding at this time. What should you suspect? A. Abruptio placentae. B. Placenta previa. C. Threatened abortion. D. Preeclampsia. Answer A. Rationale. The signs and symptoms of abruptio placentae or premature separation of the placenta are given. 143. Which of the following signs and symptoms would be present in a pregnant patient with preeclampsia? A. High blood pressure, normal pulse rate, and respiratory rate. B. High blood pressure, headaches, edema, and visual disturbances. C. High blood pressure, edema, excessive weight gain, and seizures. D. High blood pressure, abdominal pain, and bright red bleeding. Answer B. Rationale. Patients with preeclampsia or toxemia of pregnancy manifest all the signs and symptoms of the hypertensive disorders of pregnancy except seizures. Once the patient begins to experience seizures, the condition has changed from preeclampsia to eclampsia. 144. When does the third stage of labor begin? A. When contractions are 5 minutes apart. B. When the cervix is fully dilated. C. Immediately upon the birth of the baby. D. As the placenta is delivered. Answer C. Rationale. The third stage of labor begins with the birth of the fetus and ends with the delivery of the placenta. 145. What is the correct procedure for cutting the umbilical cord after the birth of the baby? A. Milk the cord of all blood and cut it no more than 5 centimeters from the infant. B. Clamp the cord close to the infant and cut it between the infant and the clamp. C. Clamp the cord in 2 places and cut it near the infant and near the placenta. D. Clamp the cord in 2 places 5 centimeters apart and cut it between the clamps. Answer D. Rationale. Clamp the cord in 2 places, approximately 5 centimeters apart, and cut the cord between the clamps. Generally, you want to place the first clamp several 5 to 7 inches away from the infant. 146. What is the appropriate range for the heart rate of a healthy neonate immediately after birth? A. 80 to 100 beats per minute. B. 100 to 120 beats per minute. C. 120 to 150 beats per minute. D. 150 to 180 beats per minute. Answer D. Rationale. Heart rate at birth is normally 150 to 180 beats per minute, slowing to 130 to 140 within a few minutes. 147. What does the presence of meconium on the neonate or in the amniotic fluid indicate? A. The infant may have been distressed. B. The infant was born prematurely. C. The infant will need resuscitation. D. The infant has congenital anomalies. Answer A. Rationale. The presence of meconium indicates that the fetus may have been distressed before birth. 148. You would perform chest compressions on any newborn whose heart rate is less than how many beats per minute? A. 120. B. 100. C. 80. D. 60. Answer D. Rationale. Chest compressions are required when a newborn's heart rate is less than 60, or between 60 and 80 after 30 seconds of positive pressure ventilation. Remember to perform each intervention for approximately 30 seconds. Then reassess for the need to continue resuscitation. 149. Medications and drugs are most often delivered to a newborn through the use of which circulatory vessel? A. Umbilical artery. B. Umbilical vein. C. Ductus arteriosus. D. Jugular vein. Answer B. Rationale. The umbilical vein, located in the umbilical cord, is used for this purpose. If the cord is left untreated at the hospital, it may be cannulated for a week or even longer. It enters immediately into the hepatic circulation. Answer questions 150 to 152 on the basis of the following information. You respond to a 2-year-old female who is postictal following seizure activity. The patient's parents report that the child was sleeping when she began to shake and turn blue. She has had a runny nose, but she has had no medications lately. There is no history of seizures. 150. This patient is most likely suffering from which condition? A. Juvenile diabetes. B. A hypoglycemic seizure. C. An anaphylactic seizure. D. A febrile seizure. Answer D. Rationale. Fever-induced seizures are common in young children with only minor illnesses. Once a child has a febrile seizure, he or she is prone to repeat episodes, which can occur at lower temperatures than the first seizure. 151. Which of the following vital signs would you expect this patient to have? A. Increased body temperature, tachycardia, and tachypnea. B. Normal temperature, normal blood pressure, and bradycardia. C. Increased temperature, increased blood pressure, and bradycardia. D. Normal body temperature, tachycardia, and bradypnea. Answer. A. Rationale. Increased body temperature, tachycardia, and tachypnea are common in a child who is recently postictal from febrile seizures. 152. What would be the appropriate treatment if this patient continues in a prolonged postictal state? A. Obtain blood glucose readings and administer 25% dextrose as needed. B. Apply ice packs to the armpits and groin. C. Remove the child's excess clothing, administer oxygen and transport. D. Administer high-concentration oxygen, diazepam, and naloxone, and transport. Answer C. Rationale. Oxygen and transport is an appropriate treatment for this patient. Remove excess clothing from the patient to passively cool him or her, but do not allow the patient to get chilled. Sponge the child with room temperature water if the temperature is excessively high. Never use alcohol on the skin as a cooling agent. Alcohol can be absorbed directly through the skin. 153. You are caring for a 63-year-old male patient with renal failure. He is pulseless and apneic. Figure 4.2 depicts his ECG. Appropriate treatment for this patient would include all of the following except A. Immediate defibrillation. B. Administration of dextrose and sodium bicarbonate. C. Administration of lidocaine or amiodarone. D. Administration of sodium bicarbonate and calcium gluconate. Answer B. Rationale. This patient is in cardiac arrest with a cardiac rhythm of ventricular tachycardia, VTach. Because the patient has renal failure, the initial approach should consist of rapid defibrillation and antidysrhythmics. All such patients should be assumed to be hyperkalemic and should be treated with a combination of sodium bicarbonate and calcium gluconate, which work together to move the potassium into cells and out of the bloodstream. 154. Which situation would constitute a moral dilemma for a paramedic? A. A female rape victim who insists on being cared for only by a female paramedic or EMT. B. A patient who has sustained a potentially serious head injury but refuses care or transport. C. A patient who signed a do not resuscitate order who is now unconscious and dying. D. A patient who is found unconscious with no family member present to authorize care. Answer B. Rationale. This situation constitutes a dilemma because the paramedic would have to choose between the duty to provide care and the duty to obtain consent. If a patient has a signed DNR order, you should honor his or her order. When a patient is unconscious, you treat him or her under the doctrine of implied consent. The rape victim is simply requesting an all-female crew, and you should try to accommodate her wishes. 155. A patient with a PMH of emphysema experiences a sudden onset of respiratory distress and sharp chest pain. His skin is warm and dry. His breath sounds are diminished on the left side. Your strongest suspicion is A. Pulmonary embolism. B. Pneumonia. C. Pneumothorax. D. Chronic bronchitis. Answer C. Rationale. The patient's rapid onset reduces the possibility of pneumonia. No information indicates any other medical conditions such as asthma or chronic bronchitis. Patients with emphysema are prone to experiencing simple pneumothorax. 156. You are called to a physician's office to care for a patient who is experiencing symptoms of a myocardial infarction. The physician tells you that she will stabilize the patient herself and that she is assuming responsibility for care. She does, however, wish for you to transport the patient to the hospital. How should you proceed? A. Defer to the on-scene physician and take her to the hospital with you. B. Request online medical direction from your jurisdictional physician. C. Ignore her request and assume responsibility for the patient immediately. D. Insist that the on-scene physician communicate with medical control. Answer: A. Rationale: paramedics should defer to a physician who is present on scene provided this individual is assuming responsibility for the continued care of this patient. Make sure you know the rules and regulations for your jurisdiction regarding on-scene physicians. 157. What does a Type 2 ambulance usually consist of? A. Conventional cab and chassis truck. B. Standard van, usually with a raised roof. C. Special cab forward van with an integral body. D. Modified suburban vehicle that can provide transport. Answer: B. Rationale: a Type 2 ambulance is an integral unit consisting of a standard van, usually with a raised roof. 158. What do you call a legal document that specifies what type of treatment a patient does and does not want to receive? A. A do not resuscitate order. B. A living will. C. An advance directive. D. A durable power of attorney. Answer: C. Rationale: the living will and DNR order are both examples of legal documents called advance directives. They specify the kind of health care a person does and does not want to receive in the event of their imminent death. 159. At what age is a person considered capable of giving consent to treatment? A. 15. B. 16. C. 18. D. 21. Answer: C. Rationale: in most states, consent for treatment must be obtained from all patients who are 18 years old or older. This can be modified in situations of extenuating circumstances, such as when an underage minor is pregnant or has legal custody of a minor child in his or her care. 160. An unconscious patient has snoring respirations. When should this condition be corrected? Simultaneously with the physical exam. B. On completion of the initial assessment. C. On assessing for the presence of a pulse. D. Before evaluating the respiratory status. Answer: D. Rationale: snoring respirations are indicative of an airway issue and should be corrected before further assessment is completed.